patient comes in for facial aesthetic surgery, very often they have been told they look tired, or they look in the mirror and they feel, this isn't what I want to project every day at work. I don't want to look old and tired. And we can help them with eyelid surgery, and sometimes it's accompanied by a brow lift. Other people feel that they look drawn or angry, and this also is benefited from facial aesthetic surgery.
I have really enjoyed being able to share the before and after pictures, because even though you look at yourself in the mirror, you don't really, you know it's a huge change, but to see it on the photographs is just, it's elation.
I was 76 when I first came to Dr. Luftman, and I asked him if I was too old to have this done, and he just told me, he said, well, there's old and there's old. And I think that you could probably do well with this, and that thrilled me very much to know that he didn't think that I was too old. And so therefore we went ahead and done this at my age of 76.
When we do an initial consultation, we try to prepare people for what their experience is going to be. And you have bandages, and you also have a degree of pain after, but we really have heard basically that there isn't a lot of pain. It's mostly an inconvenience of being out of the public eye and things like that. Was that your experience?
Yes. The first couple days there's some discomfort and there's some swelling, but after about a week that starts to subside, and I can't say that I really ever had severe pain.
You've healed really beautifully. Everything is blended in. You're able to wear your hair up, which I think is really fortunate. And you know, and I know originally I said you might have to use your hair to camouflage, but at least you're not going to have to do that.
No, and I have no makeup on them at all, so it's healed great.
So Nora, as you remember, you didn't like the brow droop and the deep folds and the jawline, and we've accomplished a lot with the brow lift, the eyelids, and the facelift. But as you've aged, gravity has taken its toll, and really your eyes still look tremendous. They've aged, but they look very pretty. You've gotten some laxity here, and I know you told me that the lines around your mouth are the worst area, and this zone down here in your jowl. So we could do a surgical procedure like a second facelift, or we could do eyelid surgery, but I think since these lines bother you so much, we should perhaps focus on the CO2 laser as our best option.
And Dr. Luftman thought that the CO2 laser resurfacing would be the best option for me, and I'm very pleased. I think he was correct with that.
I immediately noticed that my skin was smoother. I did not have the wrinkles and frown lines, and it was almost immediate. I had a little healing period, but after that I took care of my face and took care of my skin, and I was delighted with the results, and to this day I think that is probably the best decision I made with regard to taking care of my body, was to make my face look like I wanted it to, and that was healthy and not aged, and that was the way I perceived myself at that point.
That I had the surgery with very many people, only my close friends and relatives, but it's been kind of funny, especially this year during tax season. I've had a number of people say, you look different, you just look great, you know, have you been on vacation? You know, have you been exercising? Have you lost weight? And I just smile because I know I look more youthful.